So this patient's coming in, he was actually sent to me. He's had an evolving lesion over the course of the last few weeks. It's just gotten bigger and bigger. They had treated this initially with salt, which sort of made it regress a little bit, and then it sort of flared back up. And then they put a dressing on this. So the reason I bring this to you, so this is what we call a pyogenic granuloma. I'll show it to you in a minute. But you have to be very careful because the tissues will adhere to it. So this is all stuck on the underneath. I want to move this without causing much discomfort. You can see the spot underneath here, it's pretty raw. So what we're gonna do is, before I try to take any of this off, we're gonna spray this with topical anesthetic and then see if we can gently pry this off and then see if we have to put some freezing and get this off. So bear with me, buddy. It's gonna feel cold. You okay? You okay? Does that hurt when I'm doing that?
No.
So this is, pyogenic granulomas are very vascular. So this will bleed, 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 bleed. Like you see it's doing there. So we want to separate that out and then see what we're dealing with. So obviously taking this off otherwise is really uncomfortable for him. So this is what we're left with here. So try to, if you're putting dressings on these, to try as best you can to put something that's non-absorptive. So we're gonna have to do, this is way too big, and sometimes do liquid nitrogen treatments. Now if they're small, sometimes if you put salt in that environment, the salt makes it regress from a blood vessel perspective and they'll fall off, but this is way too big for that. We're gonna have to freeze this and just clip it off and put some stitches in.
Can I look at it?
You look at it 1 second. I'm just gonna put some freezing in while the topical's still acting, so you have to be brave for a second.
Yeah.
You're gonna feel a poke here. You okay?
Yeah.
Gonna feel a burning.
Ow.
Yeah, good job. Just breathe.
Ow.
Nice job. And this isn't easy, so he's being pretty stoic. You're doing well.
It gets better, buddy. It's the worst part.
Ow.
Yeah, once it's frozen, then you'll be okay. Good job.
How many times is it?
I just want to make sure you're good and frozen. You okay?
Mm-hmm.
Does that hurt as much?
No, not as much.
Getting better, right? So these can form for a variety of reasons. The most common one is just basic trauma. It's almost like hypertrophic scarring or keloiding from the standpoint of like an excessive healing reaction, but almost exclusively involving blood vessels. So typically, like even like a bite from a mosquito can cause this to start to happen. Then when it gets irritated, it just gets away on us. Does that hurt when I do that?
No.
No. And no pain through here either. Doesn't hurt when I do that?
No.
So with this size, you really only have two options. So things like cryotherapy, silver nitrate will not work in these particular cases. We have to clip this off, then we either have to cauterize it at its base or we have to stitch it closed one way or the other. So I'm just gonna clip this flat and then see what we're left with here. Just wanna make sure you have good freezing here. Doesn't hurt when I do that?
No.
Good job. Just close here. So you can see how this is just cuff that's here. We're going to take this off in a second. So what I'm just trying to see here is what would we best service with. I think we'll probably be best just doing a little bit of an elliptical incision. Move over your head here, buddy. Whoosh. just going to check my freezing. Now see, options we have here is we can clip this and then cauterize it. So what I'm going to do here is I'm going to clip this off, cauterize it, and then see what I want to do after that. And then I might just do an incision here, or I might leave it with the cautery. So I'm going to shave this flat, just like that. You're comfortable still?
Yep. Did you cut it off?
Yep.
Oh. Didn't feel a thing.
That's because you're abnormally brave. So with these ones, if you want to have any chance to cauterize them, when it's bleeding briskly like this, you have to be right at the edge of it, and then barely pull it off and cauterize it as you go. You okay?
Yep.
So I tell you, for smaller or medium-sized ones, this is all we'll ever need to do. That's not hurting?
Nope.
Because this is coagulating.
Kind of cold.
Kind of cold? That's okay. So this is coagulating those vessels that are sort of wanting to ooze on him. Now, while this in and of itself would be fine for, like I said before, the small, the medium-sized ones, because this is a larger one, I'm not going to be content with just that. So I just want to do that to minimize the bleeding, so that when I do the next step, it's just a little bit simpler for me. I have to apologize. We don't have a lot of assistance today, so that's why it's running more than it should. Does that hurt here at all?
No.
Okay. So essentially what I'm going to do is I'm going to do an elliptical incision of this whole area, and then I'm going to stitch it closed. Play any sports?
Yeah.
What do you play?
Soccer.
You like to be a forward, or you like to be a defenseman?
Defense.
Nice. Defense wins championships. Unless you're a forward, then they don't believe that's the case. You're okay? So this is obviously going to bleed a lot because this is all blood vessels. But don't worry about that. That'll seal back together for us once we get this out. So pretty raw through there. So again, I don't worry about hemostasis in this particular case, where people talk about, should we just cauterize this? Won't be a problem because our stitches are going to tamponade this or compress the actual vessels. Do you have any brothers and sisters?
Yeah.
What do you have?
One brother, one sister.
Where are you in that mix? You older, younger?
Middle.
Middle. That's tough. I'm the middle too. We're better than they are, but just don't tell them that. So this way, as opposed to just cauterizing, will be the most effective always in terms of preventing recurrence for these things. Now again, smaller ones, we probably would have got away with doing a couple of different things. But specifically here, I wouldn't want to be doing that to him because the odds of it recurring would be very high, especially when he's already tried a treatment that failed for him. Now, you should note, even though that looked pretty ugly to begin with, and I should have made reference to that, There is no precancerous or cancerous potential to these. This is just a pain for them. And obviously when it's so big and vascular, it sticks to everything, it bleeds all over the place, it's mildly uncomfortable. But there's no worrisome long-term issue with this. It's just a function of dealing with it and being done with it. So what about pets in the house? Any cats, dogs?
Dog.
Dog, eh? How old?
5, I think.
Oh, that's nice. What kind of dog?
Boxer Mastiff mix.
Oh, that's not a tiny one.
She is pretty small though.
Really?
Yeah.
55 pounds.
That's probably a solid 55 pounds. You're still good?
Yeah.
Good.
I felt a little tiny something there.
Like pain or just like pressure?
Oh, poke.
Okay. So if you feel that again, we can add some extra freezing, but does that hurt when I do that?
No.
All right.
Kind of did there.
Okay, I'll add some more freezing. So the reason I don't do it right away, if he's just feeling gentle prods, the freezing again itself is pretty uncomfortable. But if he's feeling it at all, I'm gonna add a little bit of extra. Feel cold? Good. There's one more here. You okay there?
Are you almost done?
Yep. Just an area. Arm's a bit of a mess. It's been oozing for a while.
Yeah.
It's not hurting when I do that?
It is kind of.
A little bit of pressure or really hurting?
A little bit.
Okay. So the only area I'm looking at, this area I'm happy with. The question becomes whether I want to add an extra stitch there or just put pressure on it. Looks pretty good otherwise. I think we'll just add a pressure dressing and see how we do with things. So we're just going to clean this up, put a pressure dressing on that, and then we should be fine.